Kevin Henry, the co-founder of Ignite DA. Hope you all are doing well, and I also hope that my good friend and co-host, Dr. David Rice, is doing well also. How are you, buddy?
I am doing fantastic, Kevin. How is life in Colorado?
You know what? Not so bad. I'm telling you, not so bad. Meatloaf might be downstairs at some point later. Just saying.
Could happen. That's a
Throwing
thing.
that out there. Yeah. So, and it's
I
bacon.
like it.
But anyway, yes.
Hey, well, I'm super stoked. I know this man needs no introduction. Jonathan Miller has spent some quality time with us in the past. Man, myth, legend sort of stuff. I don't know what's out there anymore. Jonathan, how are you today?
I'm doing great, guys. Thanks for having me on.
Awesome. So I'm extra stoked because I hear rumors that we're going to be talking about a R.A.P plan. So can you tell us what the R.A.P means and where we're headed?
We call it a R.A.P plan or a P.R.A.P plan, which is essentially it's a recovery acceleration plan. So R.A.P. P.R.A.P plan would be your practice recovery acceleration plan, but I prefer R.A.P plan if you ask me.
I'm with you. I'm an acronym guy.
Yeah.
Awesome.
So how's it start?
All right. So the first thing is we want to look at leadership in crisis. Okay. There's 4 questions that we want to make sure everyone's able to answer through and through. And I think we echoed this. We may have talked about this once before, but I'm going to say the 4 questions again, because that's where it starts.
Yeah.
And that is, are you communicating clearly and calmly? Number 1. Number 2, are you staying connected to your people virtually? It's a must. Number 3, are you protecting your people's livelihood? And number 4, are you reassuring your employees? And I would love to be on some of the calls where you were on there, David, in terms of talking to your team or Dr. Picano talking to the team, just because sometimes the team needs to hear from you that, hey, it's going to be okay. And I say sometimes in normal circumstances and a lot of times in this circumstance specifically. So that is where you start, is in that leadership in crisis mode, because now it's how we react during this crisis that is going to take us out of it. Yeah. And so we call it kinetic recovery. Kinetic recovery is really the concept that is when a plane takes off, it uses most of its energy to get up and get to level flight. And then once we're level flight is when those seatbelt signs come off and you're approved for your electronics to use and all that stuff. And now they're in cruise mode. They're at cruising altitude, is a term we hear often. And then when we descend and when we come to a complete stop, we use another ton of our energy, talking about flying a plane in this course, to come to that stop again. Well, believe it or not, it was a ton of energy that was used to turn everything off the way it is today. And some of that energy is still in use mode for PPP loans and stimulus plans and all that stuff. But so it's going to take a lot of energy to get back up to where we were. And we want doctors to be prepared for that. And now, while we have time on our side, is when we can start revving the engines. We really want to make sure that we're using this time to get revved up and ready to go, so that when the firing pistol goes off or when the flag drops or whatever analogy you want to use, we're ready to take off. We're ready to get going.
Oh man, I love that, especially as I think the 3 of us are on airplanes an awful lot, but and for those of you who don't fly, so that's when all the risk is too, right? Everybody, if you fly enough, once you're up at 10,000, planes don't fall out of the sky. So now is the time to get ready to rev those engines up. Kev, thoughts?
Yeah, I love the preparation side of things. And I also love, again, I'm going to always bring it back in with the team as well, because I think we've talked on a couple of these about how you don't have to know all the answers, but as long as you can keep communicating and saying, some of the answers, and it's kind of that communication in steps, it's not such a bad thing, right, Jonathan?
No, absolutely. And so that's why I want to start with those questions, making sure that you can answer those questions honestly and truthfully. If you're not staying connected to your team, I promise you they're not going to be excited to rev up the engines, especially if they're at a point where you're asking them to do it on a volunteer basis because they're still on an employment benefit. So most states legally require you to, if they're on unemployment, to say, well, this is a volunteer exercise. It's certainly not required. You're certainly not getting paid for it. And so we're asking you to volunteer and help us out so that we have a practice to come back to. Because for better or worse, we're only going to be as quick or as fast as our slowest person on the team. So it's similar to, you ever taken some time off from exercising, going to the gym, all that stuff? I know we all know Tony. I see a lot of his exercise videos, right? But it takes a while to get in the groove of the exercise habit. And then when you take time off, like a lot of us are now, it's going to be a grind getting back into the gym or getting back to, a 5 a.m. workout or even a 4 p.m. workout or whatever you're used to doing before.
Absolutely. That's like, I don't remember which Newton's law that is, right? An object that's in motion tends to stay in motion, and one that's at rest.
That's right.
Yep.
That's right.
Wow.
That's exactly right.
Well done.
It was probably a C- back in the day, but we got there.
Exactly. That's great. That's great.
So Jonathan,
where we start, let's talk about where we start.
Yeah. Can I ask you one question?
Fire away.
So, I'm not sure what everybody's team's experience is out there, but what I'm hearing more and more of, most team members who are, technically unemployed at this time, they're earning more than they earned when they were employed. So I love the volunteer aspect, but team members, if you're watching, don't think of it as volunteering. You're getting paid. We have the opportunity to come back and, to Jonathan's point, really like sprint out of the gate, because we'll already be in motion. Love that.
I really hope that those individuals that, are making as good or better money while they're on unemployment understand it's short term. We would love for you to not be on unemployment. And what if I was the doctor, what I'm really asking you for right now is your help in really business preservation. Because I want to have something to bring you all back to. Because I can promise you, the people that aren't sitting on the sidelines right now are the DSO people. They've got a team of folks sitting in a room thinking about business preservation and business continuity, and how as soon as they can, where it's acceptable in the public eye to open the doors again, they'll be the first ones to open their doors. I don't know about everywhere, but I know in California, PDS was the last to close their doors. They stayed open right up until, I think, almost April 1, when at that point, most offices had closed down for a week or so. And so they're going to be the last to close and the first to open, to try and capitalize on those patients that think it's better now to go there instead of come to your place. Maybe they want to advertise that it's more hygienic, or it's cleaner, or we have better resources, or whatever pitch they're going to use. Rest assured, they're going to use that right now. This is going to be a prime time for them to pick off those patients that are a little bit nervous about going to, the private practice, so to speak, and try and making that a negative term.
True story. So what's next? What's the next piece?
What I would ask the team to help out, first thing I would do is I'd create a Google Doc. Love Google Docs. They're shareable. You can get everybody involved. You can see who's participated and who hasn't. And the first question I would ask is, how can we create the most hygienic workplace possible? Okay, the first one. And I would want everyone's input. All input is good input here. And, for doctors on the webinar, if you will, or session right now, it's take the ideas in stride. Of course, you're going to get some ideas. You may have that sarcastic team member that says massages every Tuesday would be great for a hygienic workplace, or who knows what they'll say. But take the ideas in stride, to be willing to listen. This is how you're going to empower team members. The concept of getting people bought into a position is not so much in saying yes to everyone's ideas. It's just letting people be heard, really taking in the idea, walking through it. Maybe it's asking the team, hey, here's all these ideas. You guys eliminate the ones that you don't think we can do right away, and let's rise to the top, the good ones. And then once again, the doctor is not the bad guy here. They're the team decided. Okay, let's put it to a vote, if you will. But the next thing I would ask them then is, what's the experience we want patients to remember? Because they're all going to have an idea in their head now. Their priorities have shifted. We all can agree on that. And they're going to have an idea in their head of what the experience is supposed to be like. And I can promise you, it's not going to be like what they thought it was before. In the past, for better or worse, the bar was set pretty low when people walked in the dental office. They just didn't want to see a needle or a drill and be in any pain. And other than that, they thought, a pretty good visit. And of course, you get the negative Yelp review here or there that there was no paper towels in the bathroom, so this place is awful, or the front desk person didn't know my first name, so I'm going to 1-star review them, or whatever, those random patients will say. But today, they're going to expect to know the steps to your hygiene process, from more of a sterilization of instruments stuff. They're going to expect you to be looking out for, talking about, are they susceptible to viruses, or what's going on in their mouth that could help them fight viruses and infection off, or could hurt them. That's the kind of conversation I really hope dentists can agree that we should all be the first in the front line to take a hold of that messaging, and not let the MDs do it, and certainly not let corporate dentistry do it.
I like that. Kev, what are you thinking?
I think that it goes back to what you and I have talked about so often where we've been out on the road, Dave, is about how that they need to be thinking about their practice like a business right now more than ever, not just like a dental practice. And having that business plan right now and getting all of the people who make your business run on the same page and moving together. I mean, it's such good stuff that you're preaching right now, Jonathan. I hope people are listening to this.
Yeah.
I'm glad that you said the business plan part. I think it's important to, in the event that people are out there re-examining their business plan like they're supposed to be, I think one of the first things they should look at is just reanalyzing their numbers and saying, okay, what would make this year a good year? It's not going to be growing by 20% over last year. That's probably out the window for most offices. It's not going to be, oh yeah, 35% growth or profitability or whatever. You're going to need to say, okay, how can I make this year? In some cases, how can I make this year salvageable? I mean, look, I'd love to say, how can we thrive and how can we exceed last year? If you want to shoot for those numbers, by all means, great. But the first thing you should do then is say, okay, if I want to tack on 10% growth to this year compared to last year, I'm not giving up on my goal because I was out for 4 weeks or 6 weeks. Then you need to take that goal now and divide it by roughly 6.5, because there's going to be 6.5 months left in the year, I think, for most offices. We'll just drop off, January, February, we'll call that gravy for now. And let's see what we can do in the next 6 to 6.5 months. And divide it by number of doctor days and number of providers that you have, including doctors and hygienists, and then see what your daily goals leading into your monthly goals should be. So there's just going to be a little bit of math required, but it'll be very rewarding to say, hey, let's put these big pie in the sky goals out there and see how close we can get. In some months, I think you're going to exceed them because I'm hoping that if we take charge of the conversation, we'll be able to grab this pent-up demand that's sitting there.
I like that. I like that a lot. So how do we best take charge?
Well, the first thing is once you get your team on board with helping you preserve the business and have something to come back to, then I think it's doing the math on that, running the numbers and saying, okay, let's say that I was going to be on track to do $1.2 million this year. Where was I on track before we had the break? And then when I come back, now let's divide whatever I need to do for the rest of the year. So there's up to the break, stop. And then what do I need to do in the next 6.5 months or 6 months or whatever it is? Maybe it's only 5 for some places. I don't know. So then once you know that, now it's communicating back out to your provider team. If it's one provider and it's you, then great. Now it's communicating to your scheduling team. How are we going to fill the schedule, guys? What things can we do that we're not doing today? At this point, I don't think there's anybody that's still second guessing teledentistry. I'm not saying it's going to be, the end all be all. I am saying that when we come out of this and look at like, wow, how did that practice do so well in such a short time? We're going to hear a lot of, I started embracing teledentistry. I started doing, emergency consults. I started doing things. Maybe you started even doing some of those on the weekends. You could run a skeleton crew and do some of that stuff on the weekends and capitalize. Because if you're going to come back and continue to work on Monday to Thursday, you're not going to cut it. You're going to need to add days, add provider days. Maybe you could get an associate doctor in there and get them busy through teledentistry. There's a lot of different facets. We're exploring some other options as well. One of the things we're already looking at in the beginning was bringing an associate on and getting them flush with pediatric patients, believe it or not, because there's no learning curve there with peds. So as long as you have an associate that's not like, I'll never work on peds, then hey, if you don't know CEREC yet and you don't know implants yet, that's okay. I'll help you learn that. But I do know that you can see a lot of peds right now. And the beauty of peds is there's not a lot of lab bill, if any, and the supply costs are very controllable. So pound for pound, if you will, patient for patient, if you will, if you stack them up, they can be pretty profitable.
100%. There's a lot of practices out there that make, great use of that model. So why shouldn't the traditional practice? I love that.
Yep.
Okay.
Yep. It's just funny. I'm just thinking of all the team members going, kids right now, but it's so,
I know.
But it's important. It really is. This is the time that you've got to adjust mentality. You've got to adjust business plan. You've got to adjust a lot of things. And I love what you said a minute ago about making sure that your goals are realistic for this year. Because I think the worst thing, my 2 cents, the worst thing that could happen is that we've all come through this, and then you get to the end of the year and you get some kind of gut punch because you had your numbers up here when realistically they maybe should have been here. And then that's just a kind of a devastating blow for the entire team to go, and look back at it.
Yeah.
Absolutely.
Yeah. All right, Jonathan, what's next?
From there, I'd really want to, this is all before doors open.
Yep.
So then I'd want to make sure that we can have somebody, if doctor, or we can find a team member. And if you do get some Fed stimulus money and you're able to pay some folks to get back and get started, as part of forgiveness and all that stuff that everyone's talking about, PPP. The first thing I would do is definitely go through and do some supply and inventory controls. I would even go as far as talking to your supply rep and really getting clear on where you could do better supply ordering, if there's any supply chain issues, inventory, stock issues at your, whatever supply company that is. Talk to them now and say, hey, if you see anything, hear anything that I'm going to have trouble securing stuff, let me know right away. You may have to order a little more than you're used to make sure that you have it available to you in the future. So you want to anticipate any spike in demand. And then you also want to try and anticipate any aftershocks. So there's already talk in the medical community that this may be seasonal. So could this thing come back around when school's in full swing in October, November this year, and start to kind of bite us in the butt again? There's certainly a scenario where that could play out. And so if there's any aftershocks, how are you going to be prepared for that, both from supply chain standpoint and also communication with your team standpoint? But today, before doors open, do a supply check, secure PPE as well as other supplies that are crucial, and look to mitigate any holes, with regards to securing supplies, PPE, et cetera.
Yeah, friends, that's critical. And assistance, I know a lot of you who are watching, that's your wheelhouse. So,
oh yeah.
To Jonathan's point, it's not just PPE. The worst thing in the world would be to have healthy patient flow coming into practice, and you're going to do a procedure and you reach and you're like, oh, we used the last one, or that's the kiss of death for coming back. Love that.
And then to finish it up, and I think the fun part would be, to have your team sit around and think about what will our messaging be from a we're back standpoint. Mm-hmm. So on the marketing angle, what is our we're back messaging going to look like? I point to, and I like to kind of give examples. So I point to a few things of companies that are doing now. They're not exactly saying we're back, but they didn't go away. So for example, Pellegrino, the water company, they're doing a great job, or they're donating $1 million in a fund for small restaurants or restaurant owners. I don't know if it's restaurant owners and employees, but I know it's to restaurants. I think it's a great thing. I know that I think it's H&R Block is doing a really cool thing around taxes right now, and how to do your taxes online and how to do them remotely and virtually. And they're saying, they're using really good language, like, we're in this together. We understand what you're going through. And for that reason, we're going to offer you, A, B, and C benefits. I know that Clorox is doing a particular thing where they're talking about how their certain products protect and, overcome viruses and how to clean better in your home. But so, what is your we're back marketing message be? I hope it surrounds two areas, two key things. One of them is obviously how, you as a dental practice and as a dental team have been, OSHA controls, infection controls for years, and all the processes that you now take in accordance with that. And then I hope that it goes to, from there, from OSHA controls and infection controls to then the oral systemic link, and how we know if we take care of your overall oral health, your body's in a much better position to fight off viruses and diseases and infections and all that.
Okay, guys. I think that bears repeating, don't you think, Kevin?
Great point. Absolutely.
So, infection control, oral systemic link, if you're not already preaching that to your choir of patients and your teams, those are two very strong positions to be taking as you prepare to reopen your doors. Kev, any other thoughts?
No, I love that. I really do. And I think that we are going to be, as a society, so thinking about staying safe, staying healthy, whenever we're all back to being normal, that I think those talking points right there are really going to strike a tone with a lot of the patient base.
I love them. Jonathan, any last pieces of advice? That was a ton of tremendous content.
I say, look, we don't know when we're going to come out of this. I would love to, as an owner, a doctor, and as a team, really try and see if you guys can find a date that you can put on the calendar and say, we're going to go back this date. Even if you have to move it, try and bring some certainty to the group. Look at, your state dental board or your county, because the shelter in place stuff is out there now, and see if there is a date that you can get everyone comfortable around when we can say we should come back. I wouldn't tell the world the date, but I'd let your team know that, because that all gives us something to work towards. And that gives us some certainty in an area to focus on, so that we know our efforts are all going to center around this date. And I know that team members alike do better when there's a deadline, as opposed to it's just kind of open-ended. We're doing this Google Doc thing to hang out with. But overall, the final thoughts would be, not just hang in there, really do some work and find something positive to focus on, and share with your teams as much as you can the positive side of things. It's just so much going on out there. There's so much negative side of stuff that we really are encouraging our doctors to get connected at least once a week with your teams and share nothing but positive stuff.
Man, I love, love, love it. And Jonathan, I promise I will give you a heads up to our weekly team meeting. You are always more than welcome to join.
I love that. That'd be great.
It's they're quite a group. I feel so very fortunate to work with them. They're amazing. But everyone who's watching, R.A.P plan. You may not like the music. You gotta love the plan. Jonathan, thanks so much. Kev, I'm sure we'll be chit-chatting later today. Everybody, appreciate your time today. I hope you have a great rest of your day. And until next time, gang, together we rise.